Welcome back. We are focused on coronavirus this morning. Several new cases now reported in the United States, including one in Massachusetts, 3 others in California. This brings the total in the United States to 11 people infected nationwide. Samples from several New York City patients are being tested at the CDC today to determine infection. More than 17,300 people in Asia have been infected at this point. At least 362 people have died, all but one in China. Joining us right now is family physician, Rowan University School of Osteopathic Medicine Associate Professor, Dr. Jennifer Caudle. Dr. Jennifer Caudle, good to see you this morning. Thanks very much for joining us. Give us your reaction to this, and then, of course, we want to ask you what people should think about doing, what we should be doing to stay safe.
Sure. So, my reaction is this. In many ways, I'm not surprised that the cases have really been surging. As you mentioned, over 17,000 cases, over 300 deaths. This is something that I think we might have started to predict as we've seen over the last few days. The cases really are increasing somewhat exponentially. I've read reports in the last 24 hours that researchers are considering calling this a pandemic. And of course, we know the World Health Organization called this a public health emergency, which is very, very appropriate. So with that said, it's not entirely surprising that the cases are spreading. We do have 11 cases in this country. We probably will see more cases in this country. I think what's really important, though, is to remember that despite this, at least in the U.S. right now, our risk is still considered to be low. And that's what we as people need to be focusing about here in this country, and not sort of inciting panic. The risk is still low, but we are likely going to see, more cases. Absolutely.
Doctor, where are you?
Well,
more
so far, yeah. Go ahead. No, please.
Where are you more at risk? I'm a frequent flyer. I'm sitting on an airplane, sort of trapped with folks. Are those the environments when you're more at risk in the United States? I'm just trying to figure out if we're going to be protective of ourselves, how best to protect yourself.
Right. So we think that risk is dependent on exposure. So that's and that's, I think, a really important point. That's one of the reasons why in this country our risk is noted to be low, is because we are not in China where we're seeing this exposure. To your point, you're asking, is it safe to fly? Is it safe to do X, Y, or Z? First of all, we do know that many borders have been closed or they're being modified, etc. We have a full screen up. These are some prevention tips besides some of the closed borders, etc., that we're seeing that we should all be doing right now. We should wash our hands. Soap and water, really, really important to prevent the spread. This is an upper respiratory virus, so you want to wash your hands. Don't touch your face with unwashed hands. Avoid touching your face at all, really, if you can. Avoiding contact with people who are sick. We consider close contact to be being near somebody within 6 feet of them. Covering, obviously, our cough and sneeze with a tissue or with our elbow. Don't sneeze into your hand and then touch a doorknob. And then, of course, cleaning and disinfecting objects and surfaces. That's really, really important. This is general hygiene. This is sort of common sense hygiene that we want people to be using no matter what. Got a few other tips for you, which I think are very, very important. Stay home if you're sick. I think it's really important that sometimes in this day and age we want to be warriors and go to work at all costs. We shouldn't be. But this is the kicker right here. And you're asking about travel. Should you be afraid to get on an airplane? Well, look, if the airplane is flying to the country and it's okay, I think that's probably fine. Of course, we're not flying to China and things like that. But this is the thing. If you've recently traveled to China, you've come back and you've got a fever, cough, shortness of breath, etc., please talk to your doctor, see your doctor, get a flu shot, etc. Now, this is what you should not do. Don't travel to China. We know there's a level 4 warning. Okay, let's be clear about that. But face masks, let's talk about that. These are selling out on Amazon and CVS and things like that. Right now, there is no need to wear face masks. We are still at low risk according to the CDC. And then the other thing is prejudice is not okay. We are seeing increased rates of racism, xenophobia, etc. You cannot assume that somebody is at any greater risk of coronavirus just because of what they look like. That is really, really important for us to keep in mind. And of course, not to panic. That's what we don't want as well.
Yeah, it just feels like it almost looks like and feels like the common cold, certainly the way that you're saying to handle it, and
That's
yet
right.
People are dying. Why is that? real quick.
That's a really good point. Why is that? Well, first of all, we don't have a vaccine against this. We don't have it for the common cold either. We also don't have a medication to treat it, which is the same as the common cold. Maria, to your question, you're saying why is that? We're still learning a lot about this virus. It is an upper respiratory virus. We know that it affects people differently, so we're still learning a lot.
All right, I see. Dr. Jennifer Caudle, thanks very much. You've been incredibly helpful. We so appreciate it. Good to see you.